Benny and Rocky here. Rock, the Little Leaguers are deep into their World Series now, where we got quarterfinals today.
Now, are they still doing that dumb stuff where like they take their stud pitcher and like throw them every day? Those days have come and gone, right? You know, they're throwing the arms off these kids.
I do not know. Let's talk to a guy who does know. Dr. Tim Kremchek, welcome back to the program. Always a pleasure.
Hey, guys. How you doing?
Doing great.
Good.
And Doc, you were on hold there, and you heard what Rock said. Are those days past where they take the stud pitcher and just go out there and run him to just till he drops?
You know what? I think for the most part those days are done, although it does still happen. It's incredible. I mean, you talk about the Little League World Series. Years ago, I used to be a huge fan. I don't even watch it on TV anymore. It makes me sick. It really does. I mean, the politics that have gotten involved with Little League Baseball. Little League Baseball is incredible. Years ago, I remember calling and talking to the head guy at Little League Baseball. We talked about curveballs and, 13, 14 years old is when they should start throwing them. They agreed. And then all of a sudden they got a lot of backlash, and they turned around and found some reason to justify the fact that these 12-year-olds can be throwing breaking balls every other pitch. Watch it. It's one breaking ball after another. Every team, every country. It's incredible to watch.
And to that point, Doc, just my dad, he was born in '53, so this is probably around 1960. He was pitching, throwing curveballs, threw a bunch, and this is obviously before they knew a lot. But he had his funny bone moved surgically. He's got a huge scar on his arm, and they basically moved that thing up. I mean, but that's kind of where it's come. But it sounds like, maybe not to that extent, but in some ways, it's still kind of the same thing going on with these kids.
Well, he probably had a ligament injury. They didn't know what that was back then. It's the same with Sandy Koufax. And he had numbness into his fingers, and they moved the nerve. But really, he had a ligament injury, the inside part of his elbow. The problem with these kids is this: the justification is they can throw, they're fine, they feel great, but it doesn't catch up to them for the next few years. So in other words, they're 12. By the time they're ready to be 17, 18, be juniors and seniors in high school, move on to college, then they start having arm problems. And these kids from Hamilton that played in the Little League World Series years ago, I saw a number of them that never were able to get up and play at their high school level because they had been injured playing 12 years old trying to get to the World Series. So, the abuse is still there. I did something on TV a while back. I think it aired yesterday, actually, and we talked about the abuse of these, not just baseball players. We're talking about soccer, basketball, year-round sports, playing all the time, overuse, these injuries these kids have, and they really never have the chance to go to the next level because they've been beat up so much by the time they're 15 or 16 years old.
Now, Doc, to that point, for all the dads and moms driving around in their car right now that have kids that are playing and pitching in Little League and knothole and all that, at what age should a kid start throwing a curveball? And also, how many pitches a week would you recommend that a kid throws maximum?
Well, throwing a curveball, you've got to have somewhat maturity. In other words, you have to have the growth plates at close. So at least 13, if not 14. But the key with throwing a curveball is learning how to throw it the correct way. When I was a kid and started throwing I just in the backyard started whipping a ball around trying to curve it. I had no idea what I was doing.
Right.
And so you want to have somebody educate you on how to hold the ball, how to use the arm slot, how to do it the correct way, but you have to be mature enough to do it. And the reason I say that is if we did it, well, not we, but there was a study that was done that showed kids that were in high school that threw the ball over 90 miles an hour had a 500% chance of injuring their shoulder or elbow that would need surgery.
Wow.
Think about it. Now, what does every team look for? Speed, velocity.
Yeah.
What does every kid do? Get on the mound and throw as hard as he can. And what's saying that these immature bodies are not able to withstand the stress of throwing 90 miles an hour. Same for these young kids that are trying to throw breaking balls. The same thing. As far as the number of pitches, it's the theory of six. 6 times their age every 5th day. Now, the problem with that is the best player on the team is throwing, 15 times 6, and then they're going to shortstop, catcher, third base, second base, playing 4 games a day, 8 games on the weekend if they go to the end. So it's still, they're getting beat up. Because we do know this, the number one thing that causes injury, number one, is fatigue. Fatigue makes you lose your technique, which causes injury. I don't care if that's football, basketball, baseball, soccer. And it's these kids that are pitching now in the Little League World Series, been pitching all year to get here. They're all fatigued. They're all throwing to the radar gun. They're all throwing breaking balls. and yet they're playing on fumes. They've never played as many games. They've played 100+ games already. That's incredible.
Dr. Tim Kremchek is our guest. And, Doc, are you still seeing, like I know in the past when we've talked to you, you're seeing a lot of Tommy John-style surgery with these young kids?
The more I do, I mean, it's like anything, the more I see, and the further away they come in to be seen. But, yeah, I'm still doing youngsters, 13, 14, 15 years old, and they just break down, 16 years old, kids with tears in their eyes that want to go to college and play or showcases, or they're supposed to be seen this summer and they can't play. It really derails them. So I think it's smart to get to somebody who knows what they're doing as far as coaching and teaching some of these clinics, these baseball centers, and have them educate these kids on the proper amount to play. Playing another sport is excellent. I've said this before. Scott Rowland told me years ago he had a scholarship to play at Indiana University to play basketball. He loved basketball. And he said the best thing that he ever did was play that other sport, basketball. It took his mind away from baseball so he could get mentally burned out. Mm-hmm. And he was able to use the other muscles that he would not normally use playing third base in baseball. So the best thing that ever happened to become a great baseball player. And I think a lot of these great athletes that we've drafted with the Reds have played basketball and track and football. And some of these kids, the one center fielder we got a couple years ago was an all-state Georgia, tailback in football. And so it wasn't just baseball 12 months a year. And again, the mental burnout can be as much as anything. I mean, imagine playing 100 games a year at age 12.
That's what I was doing. I mean, I was playing 80 at age 12, 13.
Yeah, but you became a football player.
Right, that's true. But that to your point, I was playing basketball and baseball and football, and I was getting that balance. Because if you're just playing baseball 9 months out of the year, you're becoming very imbalanced, right? Like
100%.
Your pectoral on your throwing arm is getting overdeveloped. Your deltoid on your throwing arm is becoming underdeveloped. The opposite arm is nothing's happening with that. Your hips are becoming locked up because you're not working any of those other muscles or ligaments or joints in any sort of other range of motion, right?
No, you're 100% right. That's why you look in the NFL draft and kids going to college and they draft or they find athletes. Kids that are athletes. They've played all these sports and you can plug them into multiple positions. They're not just a unilateral linebacker or offensive tackle. They played basketball, got some balance, some jumping, used other muscles, became more athletic. And I think, please don't look away from the mental aspect. These kids need to be kids too. I mean, they need to go out with their friends and swim in a pool, go to Kings Island, do the things we all did as kids rather than every night, every weekend, traveling around and playing. And after a while, you become a robot. It becomes very, very difficult. And so I think parents and they've become some of our greatest advocates. Once they understand this and see this, they want their kids to be well-rounded too. Whether it be in school or other sports or hang with their friends, but still be great athletes. And you can still do that. It's important, I think.
Doc, before we let you go, one word of advice you'd give to parents of student athletes.
The student, don't live, and again, we're all guilty of this, but don't live for your kids. Let them live. Let them tell you what they want to do. Let them fulfill their dreams, not necessarily yours. And, a lot of these kids want to play for their parents. They want to play for dad because dad wants them to win or they're trying to get a scholarship. And if that's what they want to do, terrific. But let them do it on their own. They'll be much better off that way. Some of these kids that get pushed, you see them in tears, you see fights in the office. It really becomes messy. So let kids grow up and, guide them, educate them, push them. But, let them kind of make their own minds up. They'll make the right decisions. They usually do.
All right. With that, Doc, we'll let you go. Thanks so much, buddy. Always a pleasure.
All right, guys. Have a good day.
Thanks, Doc.
Dr. Tim Kremchek.
Smart dude, man. Great man.